And good evening. That's right, it's Sunday night again. And welcome to Bite Size Learning. I am your host, Dr. Mike Sevilla, president of the Ohio Academy of Family Physicians for just a few months more. Yes, it's me again. I know all of you out there really excited about that. But I do have some exciting guests coming up. We have a great project, something that you're going to be really interested in. But first, just a few things from the OAFP. A first announcement is, now, if you don't know about our book club, we have a book club. It's called the Racial Equity Book Club. And it's been very popular this year. And our next edition is going to be on Tuesday, March 2nd. And our discussion leader will be Dr. Wayne Ford, who all of you know. And the book is called The Political Determinants of Health by Daniel E. Dawes. And you can get more information at ohioafp.org. They've had a lot of great feedback and great discussions during those. So I encourage you to check that out, sign up for it. It is free, and we meet over Zoom, and it is a good time. It's a great discussion that's been very popular this year. Second, I want to alert you to a CME that's coming up on April 22nd. From 7 to 8:30 p.m. It's called Challenging Race-Based Medicine in Practice. This is something that our members have really wanted to get more education on. We have a speaker coming, Dr. Joseph Bedencourt, Senior Vice President, Equity and Community Health of Massachusetts General Hospital. So you can get more information at ohioafp.org. You can get CME credit for this too. And finally, yes, OAFP has merchandise. We have merch. And we have cool things. We have like a mask. It says COVID vaccine with a big check mark on it. And we also have shirts like this, if I can get it the right way. I am a proud to be vaccinated OAFP family physician. And proceeds of this go to student programs like our summer preceptorship program. So go to ohioafp.org for all of those information. Get the merch. It's a good time. And you can also contribute to our student programs at OAFP. So, all right. So coming up here, we're going to be talking about the AAFP Foundation's Family Medicine Leads Emerging Leader Institute. I know that's a mouthful. We'll be talking about that. And our two guests are Jake Brock, who is a medical student at NEOMED, and also Dr. Beth Oller, who is his mentor. So why don't we bring them on right now? And we're going to get to talking about this stuff. So hello, friends. It's great to see both of you.
Hi.
Hey.
So Jake, why don't we start with you first? So we're going to talk about your project, but tell us a little bit about what's it like being a third-year student, and how's your life going, and what do you have scheduled for the rest of the year as far as rotations and all that?
Yeah, sure. So third year has been a whirlwind, as you guys may hear. And it's definitely tough to balance all the clinic work with studying on the side for shelves and step exams. But it's been very enjoyable too. Right now I'm at Akron General Cleveland Clinic doing my family medicine rotation, and everyone there is absolutely fantastic. The curriculum they have us go through is phenomenal. I'm really enjoying myself there. And otherwise, things are going well. I'm getting married in July. So I'm planning that currently, and we're trying to keep that super small and simple because it's not easy to balance that with med school. My fiance is equally as busy with his nurse practitioner career or his schooling. But yeah, rewinding a little bit, I'm a third year over at NEOMED, and I'm from Cuyahoga Falls originally, located in Akron currently, and rotating through the hospitals around here. Next, I'm doing psychiatry over at SUMA, and then pediatrics over at Akron Children's, and then OBGYN over at SUMA again. And then I'll get married, go on my honeymoon, and then begins N4 year. So exciting stuff.
Wow. Yeah, that's you just kind of slipped in the getting married part. That's
Yeah, it's minor.
balance all that out. That's got to be fun. So Dr. Beth, thank you for being here. And for people who don't know you, kind of introduce yourself and tell everybody where your practice is and how things are going where you're at.
Yeah, hi. So I am in very rural Kansas. My husband and I have our own family medicine practice in Stockton, Kansas. It's a town of about 1,200. Our county is about 5,500. So I do full scope from ER and inpatient and nursing home care, hospice care, deliver babies, do my own surgical obstetrics as well. And we have 4 kiddos. Lila's 8, the twins are 4, Maya and Merrick, and Noble is 18 months. So things are busy at the Oller household with 2 rural docs, 4 kiddos, goats, dogs, a couple of puppies, because why not? Cats, chickens, a little bit of everything.
Oh, and Dr. Beth, you're a Facebook Live star. We're to tell people where they can find your practice, because you do a lot of Facebook Lives, which I think is very important for family docs to educate the community, let people know going on. But where can they find you on?
Yeah, Post Rock Family Medicine is our practice website. So we own our own practice, but we also have other partners that we come together so that we can see each other's patients and fill in and stuff. And so our overarching practice is called Post Rock. So if you go to Post Rock Family Medicine on our Facebook page, you can find lives that I've done it's crazy to think it's been a year now, and it's never something I had foreseen doing. It was daily for a while, and then it's become weekly now, and was one of those things that when I missed it a few times, I am told that they missed me that week. So
Probably by me.
Yeah. So it's been a wonderful way to reach out to our community to kind of help do what we do in family medicine, which is allay fears and try to get out there the real information from a source that they feel like they can trust. So it's been, it's been a very big part of kind of also, I think, dealing with the pandemic for me and feeling a little more in control by being able to help the narrative in our area. Just this past week, we did our 5th week of Saturday vaccine clinics and vaccinated over 400 of our community members this Saturday. So we've been doing it every Saturday, and we have almost 1,000 people vaccinated now in our little community, which is very exciting, and we are really proud of that.
That's great. Yeah, thank you for all that you're doing, just educating the community and your practice as well. And at the end of the show, we'll talk about how me and Dr. Beth met, but we'll leave that for later. That's called a tease. So we're going to really jump into this, and also at the end of the program, I do want to talk about the Emerging Leaders Institute, because I think it's very important for students and family docs, mentors to talk about. We're going to get ready into that at the end, but I really want to jump into Jake's project. So Jake, just kind of set the table for us, and I think what we'll do is, I know you do have some slides, and I think to keep this conversational, we'll if you'll allow me and Dr. Beth to kind of interrupt you during your
course.
slides.
You guys have the perfect personalities.
So take it away there, Jake.
All right, I look forward to it. So I've never used this platform except once, so make sure that I set this up right. Can you guys see this all right?
Oh, it's magic.
Thank you. I have to give credit to what is it, Microsoft Design, whichever, that gives me these design ideas. So I'm like, oh, this seems pretty fitting to this title. So that's what the background's from.
Yeah, if there's a way you can make that full screen, that would be even cooler if you're able to do that.
So it's full screen on my end.
Oh, okay. All right. Well, that's cool. No, we can all see it. So.
Okay, cool. So as Dr. Sevilla mentioned, I did a project with the AAFP through the Emerging Leader Institute, and it was a phenomenal experience. I've been doing this for about 9 months or so, and I was paired up with Dr. Beth, to work on this, some passion project that I wanted to work on throughout the year. And I chose physician burnout. Another big interest of mine is value-based care, which I know there's a lot of advancements going on, and something I'm very passionate about. So, yeah, my topic was physician burnout and practical approaches to solving it. So looking at ways to go about tackling this issue and kind of putting my own spin on it and my own, essentially my life story to fit into what I think I could add to it. And you guys will see. So a little bit about my background. We already went over that more or less, but as I mentioned, I am an Emerging Leader Institute scholar through the AAFP this year, third year at NEOMED, grew up in Cuyahoga Falls, Ohio, and I did my undergrad at University of Akron. So as you can see, I pretty much can't escape this area, whether I like it or not. Probably going to stay around here for residency too, which I think I'm A-okay with. And I've really been team family med since I started medical school. It's been a major drive for me, seeing some of the family docs in the area. Some of the first ones I shadowed in undergrad was Dr. Jeff Bechtel and Dr. Deb Plate, who really inspired me through their patient care and the relationships they had through taking care of their patients in the long term. And I'm sure all the primary care providers watching this can relate to that, where it really is unique that you're able to build those relationships with your patients through years of taking care of them and their families. So we're going to go over this a little more at the end, as Dr. Sevilla mentioned, on what the Emerging Leader Program is. They are taking applications for the next year. The deadline is coming up in just a couple weeks, but I wanted to get this out for all the docs or the students watching this that think that, hey, this person that I know might be a good candidate for this program. It's an AAFP sponsored program. They choose 30 medical students and residents to come during the national conference weekend to work with them and work with their group of docs that really are just heavy lifters in their field, essentially, where they work really in leadership roles through the AAFP and really do groundbreaking work through that. So that's how I got connected with Dr. Beth. Actually, I was paired with a different mentor at first who had to do more work on the public health field. So I got transferred over to Dr. Beth, and it's been phenomenal ever since. So yeah, I've been working with her on this project. I've gotten leadership training through this program. And as mentioned, this is the project that I choose to go with. So the problem that I wanted to hit, as I said, was the physician burnout. It's a big issue, especially among the field of family medicine. As you guys know, we probably all had lectures on it. 46% of family docs report being burnt out, and that's actually 5th highest among all specialties. And that's coming from Medscape, who does a lot of research on burnout. So one major factor of this is increased clerical burden. So with the implementation of EMR, and I'm sure Dr. Sevilla and Dr. Beth, you can both say this with certainty, more time that you're on the EMR and less time you're spending with the patients is going to lead to more frustration. You're there, you became a doctor to be with the patient, you want to do patient care mostly, and when you have to do little nitty-gritty work on the computer and doing EMR and billing and all that, those sorts of things, it becomes more frustrating and takes away from that joy.
Now, Jake, if I could interrupt you, there might be some technical glitches here. I don't know if you can like unshare and then reshare your screen.
Your slides weren't advancing, and I know you were referring to them, but it was still just on the title slide.
Got it.
Tech knowledge.
I know. Goodness.
See what a mentor, like right. She's got your back, and hey. Mm-hmm.
Yeah, I've seen these slides. I knew he had specific slides from all of this. Caitlin says share from the application lab.
Right, which I did.
I know nothing about what that
Anything here?
This worked during rehearsal, so
I know. Can you guys see this? How's this? Anything?
It's still the same. It's kind
It's
of
still
that.
kind of stuck. Yeah.
All right, hold on. Let me try something else.
I mean,
Yeah,
if not, I mean, it's
no.
not essential that you have the slides, so we can just make it very, very conversational and
Right. That's true. That's true. It might be
we've
not what I
Well,
wanted.
and while he's trying, he and I talked a little bit though about how he got switched to someone else originally. Ooh, maybe it's doing it. I started out as one of his faculty members, but was not assigned to be his mentor, but then happily stepped in. There you go. Now it's working.
It works.
Good.
It works.
Good.
You can start. You can start back, or you can start wherever you like. You can start
I'm
over
gonna go back here.
wherever you like.
I like the idea of just having a conversation, but I did make this PowerPoint, so I guess I should present it.
Yes.
So, going back over this, so another thing, and I'm curious on your guys' perspective on this too, the narrowing spectrum of practice for family practitioners. So I got some statistics that I looked up that is specifically more towards obstetrics and hospital work. So obstetrics, they used to do a lot more back towards the beginning of when family medicine was created as a specialty. 1978, about 46% of family docs reported doing obstetrics regularly. Now it's between 5 and 10%. So through your guys' experience, I know, Dr. Beth, you do obstetrics pretty extensively. Dr. Sevilla, do you do them as well?
No, but I can tell you our practice here in our little town in kind of semi-rural Ohio has been around, I don't know, 35, 40 years. And back in the day, the family physicians who were there, did deliver babies. And what happened in Ohio was the liability in Ohio skyrocketed to the point where even family physicians couldn't be able to do that anymore. So that was part of the reason for the stopping of it in our practice. But I think in Ohio in general, that's what happened too. But at some point in our practice, I still have a lot of my patients who say, hey, doctor, so-and-so delivered me, and I still have those patients in my practice.
Yeah, and I think that's super satisfying where you deliver several generations, you deliver mom or you deliver her child as well, and you're with the whole family. I think that's an extremely satisfying feeling. Would you agree?
Yeah, and I have 4 generations of several families in my practice, which is lovely. And it is so much fun. Also, we had a period of time 2 weeks ago where delivered 5 babies in 6 days. Like, it was crazy. It's not normally that busy around here because we are a small critical access rural hospital. But we have the times where it does get busy like that. And then it's a lot of fun because the next weeks and months are following up those babies. And there is such joy in being able to see them come back every time and see how much they've grown, and having delivered their older siblings and watch them interact, and really having a feel for mom and dad is so special too. And knowing, what issues their other kiddos have had and kind of helping them through that, and knowing what their parents are going through, and, that they've just lost a grandparent because you care for them too. Like, it is an extremely special thing. And it's also, it's a blessing and an honor of family medicine. I was with one of my patients about 3 weeks ago when she passed away from COVID, and being invited into those very special spaces and times in people's lives. It's something not to be taken lightly. Like, we're welcomed into some of the most difficult times of people's lives. And it's a joy.
Yeah, absolutely. And that's what I hope for my career too, is that I become an integral part of the community that I serve. And I'm able to, like you said, be part of those conversations and be that guidance that they need during those difficult times. Because I think it is very powerful, very connecting to be part of that. And the reason I mentioned this too is that there's been research done on the spectrum of practice that you have as a family doc and your burnout rates. So they found that family docs that did more full scope, like Dr. Beth does, tend to have lower rates of burnout than those that have narrowed their spectrum to things such as outpatient, which seems to be more and more of a common thing in at least the area that I'm at. So I thought that was very interesting as well. And the other thing I wanted to mention here is work-life balance struggle, which I've seen many docs struggle with. I've seen a lot of family docs do really well at it. They don't take any of the work at home. They spend a lot of time with family. They have a very manageable caseload. Whereas other docs, I was just did an elective in a rural location near me, where the doc told me he was charting 3 to 4 hours every day just about when he got home. And he didn't get home till 5 o'clock. So the amount of family time he got, and he was a very family-oriented guy, was the time he got with his family is probably much less than he liked. And I can't imagine that doesn't affect someone's burnout or their quality of life. And I wanted to ask you guys too, what's been your experience with this struggle?
I mean, it's an ongoing thing. And I guess I would say, yeah, I do some charting after I get home, and then trying to balance family, and then trying to balance like my physical health and emotional health, and but yeah, I mean but there's like anything else. There's good days and there's bad days. It is real. As time goes on, I've had a better time trying to deal with that, and especially talking with my family medicine colleagues around the country and around the world on how they do this. But it's real. But we try to find our own way on how we can find that balance.
I did blogging as a new physician through AAFP, through emerging leaders. I'm trying to think of what it was called. Mike used to blog for it too.
Like New Perspectives or something.
New Perspectives, that is what it is. So there's a blog you can find on the AAFP that is from new physicians, so physicians in their first 7 years of practice. And I have 2 or 3 blogs on there that were very much about this, because it was a struggle for me. I felt like I was supposed to be at work all the time, always be available. If I wasn't there a day and my patients were frustrated about it, I felt guilty. And then as, I added children into life, I realized I wasn't happy because I wasn't balancing well, because I didn't say no to anything. So Jake heard me talk a lot about this during Emerging Leaders Institute when I was faculty on his track about learning to say no and what's important. And what I realized to me was I do 3 days a week in the office where I am busy. I'm happily busy. It's a good time for my patients. I leave them plenty of time, but I'm busy and I like it. And what this allows me to do is then have the bookends of my week, my Mondays and Fridays. I get in, I do charting, I do administrative stuff, but I'm mostly home with my babies. And so that work-life balance for me, especially delivering babies, since I'm gone anyway, sometimes overnight, evenings, multiple days at a time if there's 5 babies in 6 days, that really helps me keep that balance. And since I implemented that when our twins were born, the joy just came back greatly, because I feel like I can give my best to both places. And there are times when one part of life pulls you more, but that's okay, because it's balanced later with the other. And so that to me has made a huge difference. And there's things I do, like Mondays, I do therapy every Mondays. That's one of my things for me that I absolutely like. It is a non-negotiable. That is some time for me. So I think it's important too to carve out some of those things that are your non-negotiables. Oh yeah, and Mike Ditch, he found my Fresh Perspectives blog.
We're gonna have to look at that later. But yeah, thanks for sharing that. Even as a third-year medical student, I don't have quite the load that maybe some of these docs do, but it's still a struggle to be a clinic full-time and then come home and have to study and try to, spend time with friends and family and have other life goals outside of it. And that's, I actually had to cancel Ironman training last week. I was training for one this summer, but I just could not make it work with my schedule. I could not get time to do the workouts, and that's just one. I have to be realistic, and But at the same time, some stuff, like getting married this summer, is non-negotiable. And like Dr. Beth said, I had to say no to some stuff, and it's what every doc has to do. So the focus of my project, largely relating to this, is that one thing I really wanted to focus on was how practical, how helpful, and how interested are docs in taking an extended leave, sabbatical term, leave of absence, whatever you'd like to call it, where you can really take time to focus on these aspects of life that you haven't had time for because of the busyness of doctorhood, essentially. So I wanted to look at all these 3 questions in surveying 51 docs from different academia, community practices, private, hospital-based, all different ones, and get their perspective on it. And then that also develops into looking at other potential solutions as well. So when I was an undergrad, I actually came across this blog, and it was talking about Dr. Janice Bonden taking a 2-year sabbatical after 17 years of practice as an IM physician in Idaho. So she loved her practice, but she just decided that she had a lot of life events that were going on that she really needed to take time for and take time off. And she did that for 2 years. I think that is maybe a little extreme, especially for a lot of people here. 2 years is way too long, but just taking 3 months, 6 months, however long that someone finds appropriate, I think is very powerful. The activities that she started doing was she did extensive medical education, ultrasound training. She did enrichment activities, meditation retreat, Locum Tenens she worked as, a lot of quality time with family. As her son graduated, she treated leishmaniasis in Sudan, and just a lot of things that she would not be able to do in her normal everyday practice. And she got a lot of grief for it too, because she essentially was quote unquote leaving her patients behind, patients she had been with for a while. And her quote was, "Our patients will be better served eventually if we love what we do and are better at it." And there's data out there too that says burnout physicians do unfortunately have worse outcomes. And that's one thing that having rejuvenation through doing something like this, I think can be very, very beneficial towards the practitioner and the patients. What are your guys' thoughts on that?
I mean, that's a fascinating concept, to have that experience, from a real world perspective. I don't know how many physicians would have that kind of opportunity. Because I'm in private practice, and 2 years is a long time to be away from medicine, to be away from patients, and but it's definitely something, an opportunity, maybe something similar like that for people to kind of have them recharge, to have them look at things differently. But I'd be interested to kind of read this physician's experience, and I think you said there was a blog, so I might have to look that up after the show.
Sure.
Yeah, and when Jake and I had talked about this a lot, he stumbled upon this, but we realized 2 years is not something most people are going to be able to do at all. But how different would we feel if this was something that, instead of being just so novel, was not that surprising, that somebody might say, it's been a couple years and I really want to take 3 months because I want to travel back. I think of my things. I want to travel back to Zambia. I want to go help my friend who runs a nonprofit in Haiti with maternal care and things like that. And if it became something that was a little more normalized, then, if we're in a practice like ours where our patient or our partners can help pick up some of that slack for a period of time, knowing that we would give it back to them as well. That it would be something in the practice that was accepted, that every once in a while somebody takes this 3 months off. And when that happens, everybody pitches in to make sure their patients are still cared for.
Excellent. Yeah. Thank you guys for sharing that. And going more so on why this is personal to me. So I took 2 years off actually between undergrad and medical school, and I got to do a lot of really cool things. As you guys can see, I have a history of training for triathlons, doing marathons and that sort of thing. And that is really something I absolutely love. And as I mentioned, I could not do it this year because of the intensity of medical school. And that goes along with future careers as a doc too. A lot of these things, they take time. and they take energy. And after you're at the clinic for 10 hours, I had no desire to go and do a 2-hour workout on the bike. So it was difficult. And another thing is I spent 9 months in Peru working in a school. Here, there's a photo on the in the corner here. I worked in a school for about 9 months and met incredible people. And it shifted my perspective entirely and really actually developed me hugely as a person. Appalachian Trail through hiker. I know that's a lot of people's life goal as well on their bucket list. I was able to do that over 4 months, 3 days, and I made some of the strongest friendships through that, and it was such an experience. Another thing is I actually met my fiance during those 2 years too, and taking time to meet people and to get out there and do that, it is, I think, underrated as well, and that's what really motivated me to do this project. So going to the survey. So what do these docs say? I sampled 51 family physicians from different academia, community, the community in Ohio and Kansas to see what they would say regarding this. So who's interested in actually taking this extended leave if they were given the opportunity? And that was 41% of family docs said they'd be interested in doing this. With their time off, they said largely they would spend quality time with family. 71% said they would be involved in service or enrichment activities, and 62% said they would do recreational. And I think a lot of people would do a mixture of all these things. These are just some of the things they would definitely prioritize during their time off. And then for those not interested, what are the barriers to this, or what was their reasoning? And so 40% really just said they had no desire to do it. And that's absolutely fine. This is not for everyone, especially for people who have a community that they're very committed to, and they don't have the option of having another doc cover them or whichever. And that brings up the next thing, commitment to partners and patients. 70% of docs said this is what would be the main barrier. And as Dr. Sevilla said, if he were to leave for an extended period of time, I do think there would be a huge gap in that area in healthcare and with his patients. And it's not easy to fill, I don't think. So that's been a big barrier for docs. And then another thing is finances, 43%, whether that's benefits or just funding these activities. That's what we got from the survey. So thoughts on these numbers, Dr. Sevilla and Dr. Beth?
I think many more people would be willing to do it if they did not feel like they were going to be burdening their partners if they were covering for them. And again, I think some of that reciprocity, right? If it's kind of something that's a little more accepted within a practice. So yes, I'm doing it right now, but like I will pay you back. And also, you know, somebody, if you are the only doc in an area, might just say, if I leave, there will be nobody here, and I don't necessarily have the money to pay a locum to be there the whole time I would be gone. So that's tough.
Yeah, I would definitely agree with those points. What I most interesting to me is 40% says no desire. I mean, it would be interesting to kind of dive deeper into that to kind of see as far as what the thinking is. But that's the number that jumps out for me on this page. Got it.
Yeah, I'm not sure either. That would be interesting to actually have a conversation. And for some people, I'm imagining it isn't something that they think. And I actually got a lot of quotes in here as well that I'll go on later on what their perspective on this issue is, and we'll dive into that a little bit. So another thing I did is I looked for policies for some of the organizations and the health systems nearby my area. And I talked with some of the CEOs, I talked with HR, and I asked about whether or not there was any policy relating to leave of absence, sabbatical term, whichever you want to call it. And really, it's rare. I could not find any organization that had this. And it seems to be on a single basis where if you had a conversation with your employer on this, or it was in your contract, then it could happen potentially. But really, medical leave and maternity were the limits to this, and obviously PTO as well. So I have heard of docs that were passionate about service, for example, negotiate time off in their contract. And also some docs between shifts and career, they would take these months off and do that which they weren't able to do during their practice. And Dr. Beth mentioned Locum Tenens as a solution to you taking a leave, essentially. And one barrier to this is the cost. I know a lot of docs are saying this is too expensive. We cannot hire any locum tenens to take the place because it's going to be an absolute fortune. Some of the quotes I got, and here are the sources here, $800 a day to $372K per year were some of the amounts that I got to have a family doc staff your clinic. So the biggest concern too is that you don't know personally necessarily the docs that will be taking care of your patients, and it is going to be a risk. They might be board certified, but what's the personality like? How committed are they? And those sorts of questions that might arise. As I mentioned, the quotes that I got through my survey actually took me by surprise, but at the same time, very logical, and I can't agree more. Essentially, they're saying burnout is a much more complex and systematic issue than just taking time off. There's so many things that go into it, and just leaving the situation and coming back to it the same is not going to solve the issues. And I really couldn't agree more. And one avenue that I looked at is direct primary care to see if that's the issue, if that's the answer, because that is something that is popping up in my area. That's something that in family medicine that there's a lot of docs gravitating towards because of high demand practices that really make it hard for that balance. And I talked with Dr. Jeff, what's his name? Last name Umber, who Dr. Beth actually set me up with, and he is CEO of Atlas over in Wichita, Kansas, and he helped set up 600 direct primary care clinics. And I got to talk with him and kind of get his perspective on things, and I came up with this graph. So some of the pros of going about this: there's less clerical burden, less patients with more face-to-face. You don't have to worry necessarily about all the billing because you don't have all the insurance and the hoops to jump through. And many times it is low staffing. And sorry, I guess I am assuming also that most of the docs watching this understand what direct primary care is. But a quick sentence on what it is: it's a more simplified version of providing healthcare to a community of people where they do not accept insurances and they have a smaller patient panel that pays a certain amount each month for services. So it is much more simplified, but it does, as I said, come with cons as well. More research. There is research saying that there could be decreased ER visits, but that's limited as well, as this is something that's up and coming. And also contracting with companies, if you own a mom and pop company and you want your employees to have health coverage, just contracting with a doc that does this makes it much more affordable potentially than contracting with a larger health provider or insurance company. Some of the cons: you might have to downsize your practice. These practices, a lot of them are about 500 patients. Dr. Sevilla, Dr. Oller, how large would you say the average practice is that's not DPC?
Wow. I mean, it's definitely variable where you live. So it would be even hard for me to even guess. So I don't know if Dr. Beth has a number, but I definitely don't.
I think a lot of family docs, definitely have at least a 1,500 patient panel. I know that there are those metrics out there that are saying it, but yes, I mean, limiting, for example, to 500 would be a huge limit.
Right. So at that point, it's hard to say what would you do with those patients especially ones that are relying on Medicaid and Medicare for their insurance or have insurance through their work. That's definitely one of the cons of doing the DPC. And I'm curious too, if there are any DPC docs listening in on this, their comments would be well appreciated as well. Other things I mentioned: high cost referrals and test imaging, and still requiring crisis insurance, where those are all things that can be major burdens for people who provide this type of care or seek this type of care. Another thing that I looked at was innovation through EMR. I came in contact with Dr. Steve Waldron of the AAFP, who educated me on this with the collaboration of the AAFP with a tech company called Suki.ai to really simplify EMR and make it much more efficient so that you're spending less time on the computer. So all this tech that we have is amazing, and let's apply that to the EMR to help docs document in a more efficient way. Less burden for the doc, because that is a significant cause of burnout. So they piloted 10 docs for this in various regions, rural, urban, and they got a 60% reduction time on charting. And then after hours was up to 70%. This is earlier trials and they are expanding it more, but these results are really altering. So the doc I mentioned earlier is spending 3 or 4 hours a night with doing charting and various things on the computer relating to patient care. He can put that down to an hour and a half using the software. It almost sounds too good to be true, but things like this are coming out, and I think they are definitely contributing to decreasing burnout rates. Cost is not unreasonable. $199 per month is what he quoted me. So it's something to definitely look at as a doc if this is if there is such a burden with the EMR system. And so the conclusion, coming to an end with this and opening up to discussion between all three of us and beyond, burnout's a major issue and it really does require a multifactorial solution. Taking a leave of absence, taking time off might be a relief for some people and give them more satisfaction coming back, but there are so many other issues going on in medicine in general and healthcare that really make this a tough battle. Extended time off, not everyone's interested, and it is very difficult for really most family docs, whether it's private practice, hospital-based care. There's not a lot of policy in place. There's a lot of gaps that you have to try to jump over. There's major shifts happening currently, as I mentioned, with EMR, DPC, that sort of thing. And then lastly, self-advocacy for personal wellness is essential. As Dr. Beth really mentioned, learning to say no to a lot of these commitments and taking a priority to have those, the spiritual health, the family health, all those sorts of things really is something that I think is essential to have as a family doc, as a doc in general, as a person in general. And that's something that should be emphasized for all practitioners. And that is all I got. What are your guys' thoughts on this?
I was going to say, I think one thing that we noticed when Jake and I were talking about it a lot was, I wonder if where that 40% is coming from is partially we feel guilty saying that medicine isn't our everything. We feel guilty saying that we would like to take a break from what we do sometimes. It doesn't mean we don't love it. It doesn't mean it's not fulfilling. But it also doesn't mean that it defines you as a person. So some of the comments about, taking a leave of absence isn't going to fix your burnout. That's very true. It's not, because there are, much more deep-seated problems. But it sure and certainly could help. If I took that 3 months off and went to Haiti or went back to Zambia, it's not because I don't love my practice in Kansas, and it's not because that's going to fix something. But it can help fill and add something to my life that adds meaning and brings a deeper passion and brings that back. So I think maybe in some ways there's just this natural knee-jerk reaction that it's abandoning your practice or you would only be doing this because you're miserable. And, I think in some ways it couldn't be farther from the truth. It's people that have passions about many things, people that want to explore their passions for medicine and life in different ways that would be interested in doing something like this.
Yeah, I mean, on that note, we did have a comment from one of our live viewers from Facebook, and this is from Dr. Alex, who is actually in my community. I think it's important to keep developing your skills and interests. The scope of family medicine is so large that it's impossible to be an expert on everything, but it is possible to be an expert in some things if you can continue to develop your skills and interests. So thanks there, Dr. Alex. I mean, I think that's definitely in line, definitely what we're talking about and what the topic is tonight.
Right. Yeah. And I agree. If you are a community doc and you find that there's a huge need for some sort of care that you're not a specialist in, and taking the time to go and get that training that might be a little more extensive, or whether it's a fellowship or whatever it is, I think being able to take that time off to go invest in that, I think that's really beneficial.
And one of your slides, you talked about AI, and you talked about, I mean, there is some, I don't know if there's some data, but there's definitely anecdotal stories of things like scribes, and that Suki is basically like a scribe on AI, which I know is very affordable than having an actual person there. And I know a lot of the direct primary care people sometimes have scribes or other people, and that definitely helps if you can work that in your practice. I've seen that definitely work if you work that in your system. And just trying to push the technology if you have people who are willing to try it. I'm in a group with 4 other family docs, and not everybody is as tech savvy or wants to be tech savvy. They just want to practice medicine, which I definitely understand. So it's really depending on your practice situation. I'm not sure if that's different, like in the academic world, but I know in my private practice world and the people that I talk to, I mean, we're always looking for less time on the computer, and there are different ways to do it. And there's pluses and minuses to all of that. So I just wanted to reflect on that one specific line that you had there.
Yeah, absolutely. And I'd be very interested to see how this technology works. I couldn't find any specific introductory example of someone using this technology, but if you could use it in an accurate way, in Alexa or Siri or something like that, where you could have a natural conversation with the EMR and do this documentation and use those features, which it seems to promise, then I think that it would take off so quickly and make a huge difference in docs' lives.
I guess just some other things just on your project. Be interesting to see for me kind of the breakdown of or diving deeper on things like employed physicians or private practice, rural versus urban versus semi versus suburban, that type of thing. Trying to dig deeper into the data. I think this is a great project. I definitely think it needs more study, and I appreciate your passion on this and trying to find that kind of work-life balance. And I know that it's definitely a hot topic that we're all talking about these days.
Yeah, absolutely. Yeah, and another thing that was mentioned too is the Locum Tenens as a potential solution to taking up some of that work. And I think, Dr. Beth, you've actually utilized some Locum Tenens to help pick up some of that, I believe it was the weekend work and such, to do some of that coverage so that you could improve essentially work-life balance. Could you say something about that?
Yeah, we have an amazing hospital. We have an amazing rural critical access hospital that understands that burned out physicians are not ones that are going to stay in their community, and they're not ones that are going to be the healthiest and the best to serve their community. So longstanding, ever since we've been here, so for the past 9 years, our hospital does cover weekend locum tenens. So we take call-in cover during the week and on the week, on the weeknights. But from Friday evening to Monday morning, that's covered by a locum. Now, that doesn't count for OB. That's not something I expect my locums to do. So those are still mine, and I still come in and round on those patients. But we also have a wonderful working relationship with our locums who get to know us, and they know they can call us. They know if there's a trauma in there. I'll go in there, and any of us will go in there and help. If it's a really busy weekend, we can go in and help round on patients. But just the calm that gives you, knowing that in general, your weekends are your weekends. Catch up on charting if you're behind on that, but not having to go into the hospital and cover call. It's huge. It's absolutely huge. And so I would recommend, anyone looking at a contract, for example, of saying, what are my non-negotiables? Like, I'm not cool with working every weekend or even every other weekend, maybe. That's okay. That's an all right thing to say, and knowing what those things are, and looking for a job or working those things into your contract that really, really matter to you.
Cool. So as we're time is going very quickly here. So Jake, if you have any closing thoughts on your project and on the findings that you had, because I did want to talk about the Emerging Leaders Institute before we complete our conversation this evening.
Sure. Yeah. Just my last thoughts is that again, the last point that I had is that prioritizing the well-being, whether it's a medical students that I'm with or whether you're a doc for your community, really prioritizing your own well-being for the sake of your patients, for the sake of your family. It really should be emphasized, and it may not be easy to change that, especially if you do have huge responsibilities like a lot of these rural docs. But definitely worth looking into, and otherwise, I really appreciate you guys listening in on my project. I hope to expand on this going forward too, looking at more of these developing of the EMR, the direct primary care, other options that the community is doing, the AAFP, and I'm excited to explore more.
Cool. And if people want to see kind of like the setup of the project, you can go back in the archives to October when Jay kind of outlined this whole thing, and you can kind of see the before and after. So that's very exciting. So let's shift gears here in our time we have left here. I did want to talk about the Emerging Leader Institute, and Caitlin behind the scenes, I know, has a video that will play that'll kick off our discussion, and we'll go from there. So Caitlin, if you're able to do that.
For 5 years, the Emerging Leader Institute has been developing the newest generation of family medicine leaders through specialized training and mentorship that allows scholars to polish their skills by completing a self-directed leadership project.
I started this project with very small goals, and I feel like being at the Leadership Institute encouraged me to dream big.
ELI scholars receive more than a chance to develop and practice leadership skills. They get the opportunity to make a positive impact in the real world for real people.
We found out that 85% of our providers that we surveyed did think that the resources that we had introduced improved their nutrition counseling, which is exactly what we aim to do.
The work of the preceding classes of scholars, combined with the coaching from family medicine volunteers, inspires the next class of emerging leaders.
And now, sort of after having done the sessions here, just thinking about sort of the impact that I want to have on the people that I serve and the communities that I work with, and how can I make that work sustainable.
It's been inspiring to see just how impactful you can be in your own community and others, even within the scope of 1 year.
Not only is the AAFP Foundation helping to build family medicine leaders from the beginning of their careers, through the Emerging Leader Institute, the foundation is making positive change for family medicine in the communities in which these leaders serve.
What this really is an investment in people. And when you invest in people, what you're really investing in is in the future.
These are important, where we kind of bring all these great people together. And out of that, I think a lot of beautiful things can happen.
And so I think any of these projects can turn into something that you wind up doing the rest of your life. And this is the opportunity to be supported, learn about it, get involved, and have a really big impact throughout your career.
I am a family medicine leader.
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 All right, so yeah, that's kind of a cool type of video that I found on AFPfoundation.org. And so Jake, I know you haven't had kind of like that in-person experience, which I know is going to be virtual this year. But just, I guess, going through this process and creating a project, and for those students out there who are looking to, they're curious about this program, they're curious about the Institute. What can you share about the experience that you've had so far?
So this program really helps us solidify that family med is for me. I went in fully admitting that I'm very interested in family med, but I wasn't 100% committed. And this really did solidify. And it's such an amazing resource to have people like Dr. Beth at your fingertips that can work one-on-one with you to work on your passion project. And I think that is the most beneficial part, is that is utilizing the leadership skills of a lot of these docs to take on and to learn from and utilize in your community is huge. And in a way, I do wish I had more time and energy to put into this project, because you could go far into this and a lot of these other projects too, but they understand that, you're a medical student, you're a resident, you're limited with your time, and they're very understandable, very supportive of whatever they can do. And if you are interested at all, or a student that would be a good fit, the application deadline is coming up March 14th, but it's definitely worth applying for.
Now, Dr. Beth, from the mentor standpoint, describe a little bit about your experience and what it's like to work on these projects, and why people like me should apply to be a mentor for this program, and why is it really cool?
I have been lucky to I've been faculty since the first year that Emerging Leaders Institute started, and I've been faculty lead on our track as well. And this actually was the first year I transitioned over and had ended up being a mentor, because we needed a mentor, and Jake and I had made a great connection. So I was happy to do that. Usually the faculty members, we put a lot in the first part of the year and getting the program ready, and we're the ones there those 2 days that were normally in person, that this year were virtual but actually went really well. We're the ones providing the content and the backbone of what their specific leadership track is. Then the second day, we really help them kind of come up with their ideas. The biggest problem we have is they do think big, because we all do. And it's taking these great ideas and helping to distill them into something that can be done as a project in a 9-month period of time. And then it is amazing to watch them go through and then see what everybody comes back with at the end of the year. And as a mentor, it's very rewarding to help them brainstorm through things, see how it changes, see how it develops, and learn why what they're researching is such a passion for them. And it reminds you of where you came from, where you were, and those people along the way that helped serve as mentors and as people you looked at and said, that's the kind of doc that I want to be, and that's the kind of leader that I want to be. Being able to pass that on and see people come through and say, I thought I wanted to do it, I was pretty sure, but I came out of this 100% sure family med is for me. That's amazing.
Well, cool. Yeah. So that deadline's coming up. And we have that information below there, and we're going to have it on the archives as well. So as we kind of close up here, maybe just share some closing thoughts, and I'll just make it really easy. So Jake, as we kind of close up here, family medicine, I know you love family medicine, and so why should your peers, why should medical students or undergrads or everyone, but why should they consider family medicine for a career?
So I think medicine really is all about the connections you make with other people, essentially your patients. And I cannot think of a specialty more so than family med that really fosters this environment. You're taking care of these people through essentially their health crises, their life events, their ups, their downs, all through life. And that is such a powerful way to connect with individuals, with families, and you become part of the family, part of the community. It's incredibly rewarding. And I think it does take a certain type of person. I think it takes a lot of commitment. But I cannot see myself doing any other type of specialty. And I'm very happy to be here and to be applying to residencies here in 6 months or so. And I'm excited for the road ahead.
Cool. And Dr. Beth, I know you're up for this. There's gonna be a lot of our family medicine colleagues who are just they're grinding it out. Some of them are burned out. Tell us as we close up, what brings you to work every day? Why is family medicine important to our communities? Why does family medicine rock there, Dr. Beth?
I think family medicine is amazing, especially in a smaller community, a rural community, because I take care of my neighbors. I take care of the people I love. I take care of the kids in my children's school classes. And yes, you get stopped at the grocery store and at games and at the gas station and ask questions. That's part of the beauty of it. It's that trust. It's that people know your face. They know that you're there for them whenever they need you. Seeing how much people respect the Facebook lives, for example, they say, if you say it, I know it's true. And that's a lot of weight to have on, but it makes you realize that people look to you and for things, not just medicine, but to be a part and a player in your community. And that's what keeps me coming to work, is because these are the people that run the small town that I love, and I get to take care of them.
Cool. Now I know that my burnout has really been, just eradicated, and I'm being really recharged. I love talking to family medicine docs, family medicine advocates. It recharges me. And so I wanted to thank both of you just for coming on tonight. Jake Brock from NEOMED, good luck with the rest of your year. Good luck with this project. And of course, Dr. Beth Oller, you just keep being awesome. Please check her out on at her practice Facebook page. And anything else before we close it up here, friends?
Wait, you didn't say how you guys met again.
Oh,
because I was very surprised when I mentioned your name.
I get. Well, I'll let Dr. Beth tell the story, and I'll correct it. No, I'm just kidding.
Oh, there's several. No, we were both lucky enough to be encouraged as medical students and residents to do leadership. And so leadership through the AAFP as a resident and student is a lot of fun. I don't even know how many cities Mike and I have been to together. Always by the end of the night ends up with your mentor docs taking the residents and students out to dinner and a few drinks and telling you why they love what they do, and sometimes the piano bars, singing, karaoke.
Whoa!
Lots of stuff. But it's
yes. At the very end of the show, that's the Mike Sevilla unofficial mentorship program.
Yeah. But you make connections with other docs from around the country that you get to know for the rest of your life, that you watch, that really help mentor you through your leadership journey. And it's things like that why when Jake says to me, I need somebody that does DPC, or I needed to make a connection, I was like, I think Mike's the president of your academy right now. You make these connections with people that become friends for life, even though they're all scattered throughout the country. And then you can help guide people to people who do certain things really well.
Yeah, I mean, basically, as it boils down to me, it is basically paid forward, and I could spend another hour just talking about all my mentors that I had in medical school and residency, and even now, and what Dr. Beth and I are trying to do is just kind of to pay it forward to people who, we really think, hey, you could be a really great family doc, and Jake, I know you're feeling that, and I know that, when you go to the next level, that you're gonna pay that back also, and it's always fun. I mean, talking about the stories, leadership stories, giving back to the AAFP, being on commissions, being on committees. We can talk a whole hour about that as well, but getting together with people with similar values, similar ideas, similar passions, basically family medicine. That's why we do what we do, and we want to show that. And Jake, I know that you see that. So thanks for asking that. At the very end.
In person with everyone, because the commission work is so important, the things you do as a resident and student leader and as a physician leader, but it's those times in between, and it's those evenings when you have a chance to hear from people who have been doing this for years and years, why they love what they do. That's really where your batteries are recharged and the passion is brought back to what you do.
Yeah, absolutely.
Cool. So yeah, thanks again for coming on the show, and I hope you'll come back, and we'll talk more about family medicine and whatever you'd like to talk about. But that ends our program this evening. So thanks everybody for joining us. Now, I encourage people to share this. We're going to have this all archived on YouTube and Facebook. You can share this with whomever, especially the end of the show, which is the most fun part. But till next time, I'm Mike Sevilla, and you can check out all the archives for the show at ohioafp.org and also on our YouTube and Facebook channels. So till next time, we'll say goodnight, everybody. Wave, everybody. Good night.